See you later tonight. It's my new look. Great job, Revan. Dapat ikukuan na la.
First time lang eh. First
Ah,
time. Ano man? Talagang na ginagawa to?
Last year do, kikera.
Ah.
Tapos may hikera nag-host. Tapos ako nakipapakianhan.
Ganun ba?
Oo. So, nasalingan ko, ay, pugi mo nga host. Pero sige na kayo pa, ito mga chika-chika man lang.
Chika-chika man.
Be live. So right now, I'm not the host. Previously, it was Kara. So with my first vlog, I'll be the one hosting. Okay? So I'm happy because I have a very special guest tonight. Very special gud niya kay by request ini naton. Oo. So we want to welcome our regional director for the POGs of Region 8 of Leyte and Samar. So we want to welcome Dr. Mina, the ever beautiful, the ever sexy. And syempre parang mami-mami na nato ni
Yes.
Dr. Mina, si Ricky Tagra. Yay!
Good evening, everyone. Maraming salamat, Dr. Rayuhan. It was very kind, very charming doctor, dermatologist here in Tacloban City. I'm very happy to be with you tonight. Actually,
Yes,
this is
Doctor.
also my first time.
So puro kita first time,
Yes.
Doktora. So
That's
somehow,
true.
I'm actually very nervous because I'm not used to doing hosting or anything. So I'll just try my very best to to be able to deliver yung ko, Doc, yung ko, ang tawag nito, yung role ko. Oo.
Yes.
So Doc, chika minute muna tayo.
Of course.
Oo.
Sure.
So, regarding sa where did you have your medical school, your training? Oo.
Actually, I am a pharmacist.
Wow!
Yeah, I am a registered pharmacist. I graduated Southwestern University.
Yes, opo.
1983, and then I proceeded with Doctor of Medicine at Southwestern University, also in Cebu City. And then I'm very honored because I am one of the recipient of the POGS Residency Scholarship Program.
Wow.
This is the first time that POGS offered, and
yes,
I'm
okay.
very lucky because I was able to get that very special scholarship. I had my residency training at University of the East Ramon Magsaysay Memorial Medical Center. I graduated 1995, but then again I was very fortunate because I was given the chance to proceed to have a fellowship training on OB/GYN ultrasound, which is very important and very new.
You at the time, Doc.
Yeah,
Oo.
during that time, that was really, we are the pioneer for the
1995
fellowship
years,
training,
oo.
and I graduated 1997 for the fellowship training in UERM.
Oo.
And without any second thought, I directly went
Went
home.
back, to Tacloban.
Yeah, to
oo.
Tacloban, and I can just imagine that was May 1997. I brought again with me my mga children, maliliit pa.
Oo.
And then my patients are telling me, Doktora, yung mga anak mo during that time, ang liliit pa nila. They're seeing my children in the clinic, they're playing games and everything, and now they're adults and they're professionals.
And also, I think one of your daughter is also following your footsteps.
Yes,
Oo.
yes, sana.
Oo.
Sana, Lord.
Pamati ko yung
Rather.
doktora, ma-retire na adainin.
Yes, the soonest sana.
Ay, good, oo.
At,
Parang may the good lifespan itong pagiging
Yes.
doktor na medyo active ka talaga.
That's true.
Oo.
I am just waiting for my daughter, mine.
Oo.
Pag nandyan na si mine, definitely I have to slow down my practice because at this point in time talagang hatak lahat. Clinic, hospital, surgeries,
Oo.
ultrasound, and all the stress.
Yes, oo. Kasi Dr. Mina, I've been hearing stories about her. Na-admire ko iya. Kasi ang tawag dito, hindi siya nagsa-stop from work.
Yeah.
Talagang work from morning till
Yes.
evening until So sabi ko, parang sumusunod ako sa yapak ni Dr. Mina. Mukhang from Monday to Sunday, parang walang day off. We always
Yeah,
work.
That's
Oo.
true. Now, that's the reason why when patients are calling me, Doctor, I have a clinic on a Sunday. Oh, please give me a time, give me a day to rest. Because Sunday is my favorite day because that's the only day that I have to pamper myself. That's
Oo.
for the me time.
Me time. So what
Yeah.
do you do on your me time, Doc?
I have a lot of things to do in a Saturday.
Oo.
In a Sunday, of course, and upon waking up, I have to go to church.
Yes,
Then after
opo.
my lunch, then I have to stay in a spa
Wow!
until nighttime.
Until like-
Until the closing time.
So what are the pampering activities that you do, ano?
I really love to have a weekly massage. I really love to have weekly facial and all those foot scrubs and
Yes,
the
oo.
manicure and the pedicure.
So guys, you see, that's the reason
Yes.
why, Doktora, ano pa rin, maganda ang mukha.
Yes,
Oo.
that's true. You really have to take good care of your
Yes,
face.
banat na banat. Oo.
Yes, that's true.
Yes, and in retrospect with that, Doc, that's the reason why we'll be discussing on women's health.
Yes,
Because
sure.
right now, important talaga na we should take care, women should take care of ourselves. So actually, when I browsed through internet, I saw na ang kuan pala women's health, Doc, it's already a branch of medicine.
Yes.
Oo.
Yeah.
So parang dako, it's a big it encompasses of mga parang bigger scope talaga.
Yes.
So I did my research na usually it focuses on the treatment, diagnosis of diseases and conditions na affects the woman's physical and emotional being.
Yeah.
So mostly it involves usually sa OB-GYN na aspect. So yung mga birth control,
Mhm.
STDs,
Mhm.
breast cancer,
Yes.
menopause, osteoporosis, pregnancy, ganon. So, kaya no itong women's health, very, very important po haaton.
You have to remember that women are the forerunner of our society
Yes,
now,
oo,
di ba?
oo.
Pangalawa na tayo sa mga lalaki at
Oo.
we are competitor, di ba? If
Hindi
men
na
can do
palugi,
it,
yes.
yeah, we
Then-
can also do it.
Yes.
So that's why we women, we have to empower also ourselves. We have to have an important role in the society.
Yes, Doc. Damo
Yeah.
gulit-rulit babae, di ba?
Yeah,
Number one,
that's true.
we have to serve our husband.
Yeah, that's true.
Oo.
Otherwise, iwanan ka.
Oo,
Pag hindi ka,
naku.
hindi mo
Kailangan
sasabihan
pala morning, night, and dinner.
Yes.
Kailangan mag-serve ng food. Kaya
Yeah.
naman, iba iniisip natin.
Yes.
Oo. And
That's
then,
true.
ano pa, di ba, we have to serve also, take care of our children.
For children, yeah.
Oo.
Talagang the women are anong tawag nito? Multitasking.
Multitasking, oo.
Yeah.
Kaya, Dok, imagine mo, you take good care of your kids,
Yes.
your husband, your partner, your
career.
career, your
Yeah,
patients.
Your patients.
Oo.
Yeah.
And then yung mga ano mo pa, Dok, yung mga
pe-
people behind you.
behind you, the staff.
Yes.
Your clinic.
Oo. Pero more often than not, kailangan talaga we should take care also of ourselves.
Yes, that's
Oo.
true.
So
Dapat.
importante talaga yun, Doc,
Yeah,
no?
yeah, yeah.
Na we are physically, mentally, emotionally, spiritually, yung last talaga, financially also.
Financially also. Yeah,
Oo,
that's
kasi
true.
women should also have a stable job
Of
nowadays.
course, we have to.
Oo.
Otherwise, kawawa tayo kung wala din tayong pera, di ba?
Oo, Dok.
So, mas maganda yung women you should have, must have.
Oo, mas na
Na
talaga,
meron
no?
tayo siyang income din in a month. At
Oo.
kasi ang hirap din kung yung asawa lang yung nag-isa ang magtatrabaho
Yes,
and then the
oo.
money is not enough to raise the
To raise,
children.
yes, oo.
So you have parang supporting actress ka.
Oo, oo,
So
oo.
whatever kakulangan na ng asawa, then you have the
You have
means to
yes,
support
oo.
the family.
So parang ano din, Dok, ibabalance na lang between
Yeah,
career and
that's
also yung family
Yung
life.
family.
Oo. So
Mhm.
yun. So with this, I will be asking mga questions.
Yeah,
Oo.
sure.
Actually, it starts from very serious
Yeah.
going to the parang mga kinky questions.
Okay.
Just kidding. Para relatable to our
Yes.
audience. Oo,
Mhm.
wag tayong serious.
Yeah.
Kasi in the clinic, all of us are serious already.
Yes.
Naku, sa clinic, sumasakit na yung ulo namin pag yung mga questions na sa amin.
That's true.
Parang ano ba, meron bang ganito? Oo. So, Doc, i-divide ko yung questions into reproductive,
Okay.
maternal, and
Sure.
sexual health.
Okay.
Oo. So, guys, it's only relatable questions. Oo.
Yes.
So as you all know, very popular ito na na actually metabolic disorder
Yeah, that's
na most women, even young women, starting from their puberty age up to basta hanggat may nagme-menstruation.
Yeah,
Oo.
that's
So nagiging problem them in terms of fertility. So I guess
Yes.
you know yung polycystic ovarian syndrome.
Yeah.
So ano ba yung polycystic ovarian syndrome and what is the main cause of PCOS, Doc?
Polycystic ovarian syndrome is a syndrome of diseases.
Opo.
It is associated with increased androgen hormones.
Okay.
It is associated with irregularities in menstruation. And then, what is worse is the hyperandrogenism that you will be suffering. Yung mga acne formation,
Yes, oo.
obesity,
Naku,
yeah, and then
Ako-
yung worst, yung infertility problem.
buti na lang, Doc.
Yes, nagkaroon ka
Nagkaroon
ng baby.
din ako, oo. Kasi actually me, I'm also a PCOS patient, Doc.
Okay.
I really had irregular menses.
Mhm.
And then yung problem ko rin, I was uncontrollable weight gain.
Weight
Aside
gain.
from that, guys, na malakas din ako kumain,
Mhm.
but yun nga, even if pag-restrict, medyo lumalaki gihapon.
Yeah,
Yes,
that's
oo.
true.
Yun. And then yung acne breakout.
Mhm.
Pero yun nga, Doc, yung I always tell yung patients, di ba, Doc, yung infertility, yan ang nagiging problem
Yes.
ngayon.
Mhm.
So how do
Very
you
common.
tell those patients na
One of the complications of polycystic ovarian syndrome is infertility. Infertility meaning the couple, the husband and the wife living together in a year without any contraception, pills, without any
unprotected, Doc,
unprotected
Oo.
sex, then we still fail to have a pregnancy.
So nagkakaroon ng psychological and emotional
Yeah.
problem for both
That's
the
true.
husband and wife. So parang stress din siya.
Stress related din siya. And it's more, may mga genetic din siya, predisposition.
Okay.
But then the number one cause of polycystic ovarian syndrome is obesity. Do you know why?
Ano,
Obesity, because our extra fats, our fat cells, they are exogenous source of
okay.
androgen hormones.
Hormones, yes, opo.
Yeah,
Oo.
so mas marami yung androgens kaysa the
female hormone,
female
Doc.
hormone.
So na-overpower.
Na-overpower siya. So nagkakaroon hormonal imbalance nga siya, ang tawag nga yung layman's term eh.
Oo.
Nagkaroon siya ng hormonal imbalance. So once the patient comes in the clinic, the usual complaint is minsan amenorrhea,
Oo.
o kaya yun, infertility problem. Tatlong taon na kami, 4 na taon, wala pa rin kaming baby. And then I have to explain to the patient na, is this your first checkup? Yes, doc, this is the first time. So you have to do the basic thing,
workup.
the
Oo.
basic workup that we can do here in the clinic.
Oo.
So,
Usually, Doc, what are the basic workups na ginagawa natin?
the first thing to do, you have to do pap smear. You have
Oh.
to examine first. You have to do speculum examinations,
Opo.
inspection. You have to examine the cervix if there is any problem like
Yes, oo.
polyps or myoma or signs of infection. And then the next step to do is the transvaginal ultrasound. The
Oo.
transvaginal ultrasound will be the one to confirm the presence of multiple small follicles, immature follicles,
Oo.
that are located parang rosary bead
Sa
na
yes,
umiikot
oo.
sa buong ovaries. And this is para siyang tinatawag na ano ba yun sa polycystic ovaries, subcapsular in location, then dense yung ovarian stroma niya. So confirmatory talaga yung transvaginal ultrasound
for
for the polycystic ovaries. Yeah.
But aside from the infertility and everything, meron ba siyang mga sa medical side naman na it can affect? Like, for example, di ba, Doc, prone sa mga diabetes?
Diabetes, hypertension,
Oo.
acne formation. That's the reason why patients with polycystic ovaries, we are giving also metformin. Because it is also associated with insulin resistance.
Oo nga, Doc.
So, we are always explaining to the patient na we really need to give this to normalize your menstruation, or even infertile patients who are unresponsive to ordinary ovulation induction medication. We really have to explain to them that metformin plays a role also in the management of polycystic ovaries.
Does PCOS go away, Doc?
As long as as long as the cause of the PCOS is still there, then hindi siya mawawala. But it can be treated.
Okay.
Yeah, it can be treated. It's only a big problem kung, example, kung meron kang irregular menstruation, tapos pinapabayaan mo lang siya, yun ang malaking problema dun. Kasi once you will not menstruate in amount, the tendency for the endometrial lining will
Nagtitiken, Dok, no?
nagtitiken
Oo.
siya. Tapos once na palagi siyang kumakapal, it is a precursor also for endometrial cancer.
Naku, ang hirap pala.
Yeah.
So, kaya tayong mga women, we should be very conscious of that. Kaya, that's why, Doc, during my younger years, I really went to the doctor, to the
Yes.
OB-GYN, have myself treated.
Yes,
Oo,
that's true.
kasi nahihirapan din ako nun. I had bilateral ovaries.
Ooh,
Oo. I was preparing myself for the future.
Mhm.
Not because naman na I was treating myself now because I wanted to get pregnant or get married, but
Yes.
I was preparing for my future partner as well.
Yeah.
Oo. Kasi I was also afraid that somehow baka hindi rin ako mag-bear ng child, which will cause constraint also among partners.
Yeah, that's
Oo.
true.
So, kaya guys, importante na we should take care of our
Yes.
health, of our body.
The main problem kasi with our women, inaantay lang muna nila ilang years hanggang magme-menstruate sila spontaneously, but that is not that's
So
not
dapat pala,
good.
Doc, once you are diagnosed,
Yeah.
you have to undergo the treatment.
Yeah, you
Not
have to.
necessarily basta para for the improvement ng health.
Yeah.
Yes, oo.
Among women in adolescence, the problem is the irregularity in menstruation. What is important that you're given medicine to menstruate regularly every month.
Opo, oo.
So hindi naman kailangan talaga na buntis ka
Buntis
ba? Hindi
agad.
naman eh.
So, lalo na mga
Yeah.
teenagers we don't
Yeah.
advise you na
Kasi yun ang iniisip nila, hindi, ayoko pa naman magka-baby, so ayoko mo na magpa-check up.
Oo.
So parang ganun, yun ang nasa isip nila. So pinapabayaan nila until such time na marami ng mga
complications. Oo. So, Doc, sa non-medical side naman, what do you advise these patients? Like in terms of diet?
Yeah.
What do they do? Yun.
For non-medical, it's really very important to eat the balanced diet because number one cause of polycystic is really obesity. So you really have to avoid soft drinks, mga chips, and all the salty foods.
Oo. Kasi yun din ang nagkukos ng acne, Doc. So,
Yeah.
we're always tell, avoid dairy,
Mhm.
avoid milk,
Mhm.
avoid processed snacks,
Yeah, that's
or
true.
mga processed food.
Mhm.
So, bawal yung mga food food
Ay,
panda
sorry.
talaga. Hindi naman, yung mga as much as possible, eat more healthier.
Yeah,
Oo.
processed food hindi talaga pwede.
Oo. So, yung mga antioxidant, anti-inflammatory diet.
Yes, anti-inflammatory
Oo.
diet.
Yung mga low glycemic index food,
Yes.
probiotics.
Yeah, probiotics
Oo.
is
So,
good.
and then, yun nga, before, I didn't realize also, Doc, na yung mga kimchi, these are fermented food.
Oh.
Oo, they improve actually yung gut flora ng stomach natin.
Okay.
So, para din, nagdi-decrease yung inflammation sa body.
So bad.
Oo.
Okay.
So, next, Doc, my next question
Yes.
is, kasi, I accidentally had twins.
Mhm.
Oo. Nakakatuwa kay si Dr. Mina, ang unang nagbigay
Yes.
sa akin ng news. When I went to her, I know this
Uh-huh.
sounds personal.
Yeah.
Oo, sabi ko, Doktora, I need to have my ultrasound already because meron akong so sabi ni Doktora, ultrasound na, sabi niya, oh, not only once, but twice. Sabi niya, wag ka na, dalawa na to. So, sabi ko, sige na nga, I am blessed with,
Yeah.
2 children. So,
Yeah.
how to conceive twins? And is there a trick to have twins po ba?
For patients or for couple who wants to have a twin pregnancy, they have to subject themselves for in vitro fertilization.
Ay, ang gastos pala.
Yes, magastos yan. But then,
Oo.
alam mo, patients who are taking mga ovulation induction
Oo.
medication like clomiphene, mga injectable na ovulation induction, they are associated also with multiple pregnancy.
Mas mataas din ang
Mas
risk to
mataas
develop.
yung risk to
Oo.
develop. And of course, twins is genetic yan eh.
Yes, oo.
Family.
But age, Doc, does it affect as well?
Age
Na
for-
parang like me, I got pregnant at 30 plus.
as long as you have your pregnancy before 40 years old. First pregnancy.
So
Kasi-
there is a chance pa rin, Doc?
Yes. kasi once you get, we consider 35 years old as high risk
Oo.
pregnancy. But then if you have your baby na 30 years old, then nagkaroon ka ng baby the second, third,
Oo.
after 35 years old, it's still safe. Yung iniiwasan lang natin pag mga 40s na, kasi syempre you have to explain to the patient that the risk of congenital problems sa baby mataas na,
Oo.
yung chances na magkaroon ng gestational or preeclampsia,
Mga
mga
diabetes din, Dok.
diabetes,
Oo.
ang taas-taas na. So, lahat ng mga risks na ito, we really have to explain to the patient. And if the patient is willing to risk her life to all these side effects
Yes,
and complications,
oo,
and then
oo.
go. Because we have our obstetricians who are really willing to
Oo.
take good care of them.
Yes. Look, for example, in a situation wherein we are in a situation wherein yung both mother and the child are at very high risk during the labor,
Mhm.
who do we save first? Parang ganun.
We have to explain to the family, we have to
Oo.
explain to the husband.
Just to give us an idea, Doc.
Yeah, because we have a case like that already
Opo.
na, example, a COVID patient who is
Mhm.
pregnant, and then yung bumababa yung oxygen saturation ng nanay,
Opo.
tapos viable naman si baby,
Baby,
na pwede
oo.
na siyang ilabas. We really have to explain na sino yung gusto mong i-save natin? Is the
so
mother
it's-
or the baby?
So it's still the
Yeah.
decision of the
It's the
family.
Yeah, it's still the
So
decision.
it doesn't go into the rule na, kasi parang syempre 'di ba, yung misnomer lang na you have to save daw the child so that the child can see the world. Parang ganon. Or you have to save naman the mother so that the mother can still conceive.
Yeah,
Oo.
it's still the family
So
that
the
will
family
decide.
pa rin pala
Yes.
po ang magde-decide.
It's the family that will
Oo.
decide.
So it's not definitely the mother who will decide. Yung family pa rin.
family
Oo,
pa rin.
kung
Yes.
sino ang gusto nila i-save. Oo.
Yes.
But either way, syempre, as doctors na merong sinumpaan,
Mhm.
oo, still, we want to save both.
Yes.
Oo, when
As
that
much as you
happens.
can.
Oo, yes,
Yeah.
Doc. Oo. So, next, Doc, okay, so what is infertility, and is infertility a common problem nowadays?
Infertility is defined as the failure to conceive after a year. The
Mm.
couple stays together, unprotected sex, no medication, no pills taken, but still unable to conceive, and that's
Yes.
infertility. Very common here in Tacloban, in Region 8. A lot
Oo.
of patients with a lot of infertility patients here in Tacloban.
Oo. Ano, more common ang nagkukos, Doc? Why?
Very common is infection. Infection sa husband and infection sa babae.
Is it
The-
relative, Doc, dun sa mga sexually transmitted
Yeah,
infection?
yeah.
Oo.
Very common. Sexually transmitted
Oo.
diseases.
Oo. Does age also affect a woman's ability to have children?
Yes, it also affects.
That's why pala, Doc, ayoko na ulitin.
The younger,
You can only do it once,
Yeah.
never not twice.
Totoo, that's true. The
Oo.
younger, the better. Kasi mas maganda yung mga genes pa
What's the
natin.
ideal age, Doc?
For getting married?
Parang, hindi, Doc, yung ideal age na very, maganda talaga ang reproductive
35 years old and below. That's the ideal.
That's the
talaga.
ideal.
Yeah.
Oo.
Dahil hindi ka pa man high risk niyan.
Oo, but usually, meron ba, Doc, na from sa 20s naman, meron kung parang 28 to 30 plus or 25 to
Yeah,
30.
28 is also a good age
Oo.
for getting
Parang in
pregnant.
between.
In between. Kasi
Oo.
maganda kasi yung ganong edad kasi tapos ka na mag-aral, may
Naku,
trabaho
Doc,
ka
hindi
na.
pa rin naman, sabi ko noon, ideal age to get married 25.
Yun
Nung
nga.
nag-25, nag-aaral pa.
Mag-aaral ka
So
pa.
nag-move yung ideal age to 28. Nung 28, ay, magre-residency pa.
Yes, that's true.
So kailangan matas, nag-move ulit
Mm.
ng after residency na lang para
Residency.
matapos daw.
That's true. Totoo.
Oo.
Sa sa doctors, late yung natin, ideal age for marriage, no?
Oo.
Na talaga kasi we have residency training pa eh.
Oo.
Matagal.
Doc, next, how will doctors find out if a woman and her partner have fertility problem?
Back to basics again.
Oo.
So, ganun na naman, i-examinin naman natin. So, nagsama sila sa isang bahay, 1 year na, wala pa rin silang
Oo.
baby. So, infertility na talaga yan. Tapos, yun nga, back to basics, examination,
So, we'll do that.
pap smear,
Oo.
transvaginal ultrasound, and then sa lalaki naman, sperm analysis,
Opo.
urinalysis.
Yes. Kasi 'di ba, Doc, ang problem natin, it's only the woman who does the lab tests.
Yeah.
So
that's true.
males naman, mga male natin, ayaw nila malaman because somehow males seek late medical exam or
That's true.
consult because natatakot din sila, Doc.
I also encourage
Oo.
it's really the
It takes two to tango, Doc,
yeah,
no?
yeah, that's
Oo.
true. So, kailangan talaga silang dalawa.
Oo.
And then, first visit, sige, patawad mo na. Kasi I
Kaya hindi
really,
man lang yung babae, hindi man yung babae mabubuntis, pero kailangan may magbubuntis sa kanila, Doc.
that's true. So, kaya sabi ko sa mga sa pasyente ko, sige, I will give you 3 to 6 months. Pag hindi ka mabuntis after 3 months, ay nako, examinin na talaga natin si mister. Kasi baka we will be spending a lot of money for the medicine,
Oo.
for the laboratories, and then only to find out na si husband pala ang may problema.
Oo, parang
Diba?
siya yung may pwedeng mababa yung sperm
Yes.
count or is really infertile
May infection.
or may infection. Oo.
Yeah. So,
Kaya
kailangan,
oo.
sabay talaga silang dalawa.
So parang requirement pala yan, do?
Yes.
Pag maghahanap na ng partner.
Yes.
Check first.
Sperm analysis muna. Pag wala, isusperma, ay nako, sorry, babay na lang.
Huwag na.
Dapat ba yan? May IVF pa naman eh.
Oo. So, Doc, next naman regarding vaginal discharge.
Yes.
So, what is vaginal discharge? Yung mga sakit natin and how is it
Mhm.
really diagnosed? Oo.
Normal vaginal discharge is ano siya, odorless, tapos para siyang milk na free-flowing lang,
Mm-mm.
na walang amoy. But then, once na meron siyang mga fishy odor,
Oo.
tapos meron ng mga itchiness,
Oo.
tapos meron na siyang parang tinatawag na yung sira na gatas, na namumuong gatas, curd-like yung itsura niya.
Oo.
And that's an indication na merong fungal infection.
Oo.
Mm.
Okay. Next, Doc. Bakit daw pag first day of menses, painful siya? Parang crampy, oo.
Alam mo, during menstruation, may mga hormones tayo na dumadami, the prostaglandin. As long as we were able to rule out cases of endometriosis,
Opo.
kasi endometriosis, very
Painful
common,
talaga, Doc,
painful
no?
talaga. Also adenomyosis. So kung makita sa ultrasound na normal lahat, but then the patient still suffering from dysmenorrhea, then supportive management. Because during menstruation, prostaglandin are
Is released talaga.
Yes.
Nag-increase na, Doc,
Yeah,
which cause the
nag-increase.
pain din.
Cause the pain.
Oo.
Mm.
So, next, Doc, kasi ito yung tinatanong din, pwede daw ba maligo at taking a bath while having a menstrual period?
Of course.
Is it good or bad?
Of course!
Sabi ko,
You have
ano
to-
tanong ito?
You have to think about during menstruation. Alam mo yung feeling mo pag
Hygiene, Doc!
diba? Ibang klase yung feeling mo na parang may masama na ng amoy.
Oo.
Tapos yung discharge na lumalabas na medyo may amoy din. Tapos,
Eco-batch.
tapos pag ikaw pa na hindi ka naliligo, parang ang sama-sama na ng feeling mo. So you really have to take a bath to maintain yung hygiene.
Oo. Doc, is it advisable, like for example, you put a medicine in your vagina to keep the normal flora in the vagina? Or
Yes.
ano po ba?
Yes,
Oo.
you can have we have already some lactobacillus suppository nowadays to
Oo.
maintain the normal vaginal flora. And sometimes also, may mga ano na tayo ngayon marami na tayong suppository na
Oo.
makakatulong for the prevention of infection. Yeah.
That's good. So guys, so aside from good hygiene, maganda din mini-maintain yung normal flora
Normal
na
vaginal flora.
normal vaginal flora. Oo,
Yes.
ha? So importante 'yon. Oo. So next, Doc. Ano ba tong tanong na to? Why do men have fewer orgasms than women?
Because women has more hormones, has more androgens than men. Kasi mas maraming androgens yung babae Mas marami tayong hormones.
Okay, Doc.
Yeah. Mas marami tayong hormones kaysa mga lalaki. At saka, alam mo naman, women, marami tayong mga erotic jokes. Kaya,
Akala nila yung lalaki yung
Oo.
maraming erotic
Oo.
yung babae, mas
Mas babae,
madami,
mas
madaming sexual desires
yes,
doon, no?
that's true. Kaya,
But syempre, in this country, we're in, very religious. So,
Mhm.
syempre, medyo
Conservative
may
tayo.
pagka-conservative pa tayo.
Yes.
But actually, Doc, little did we know na, medyo ngayon, mas yung mga babae are more proactive as well na.
Yeah.
Oo.
More
But syempre,
empowered.
lalo na mga teenagers, you have to be very careful.
Mhm.
Oo. Kasi, at the end of the day, kayo rin yung lugi.
Yes.
Tama, Doc, di
So,
ba?
kailangan magiging wais
Wais.
yung mga babae. Huwag tayong i-surrender yung bandila agad-agad.
Oo. So, as much as possible, if bago mag-surrender ng bandila, mag-aral muna tayo,
Yes.
magtapos,
Magtapos
chase your
mag-aral.
dreams.
Yes.
Oo, anyway, nandyan lang naman yung kasi actually, nahirapan din tayo, Dok, kasi yung iba, syempre, they will engage early in mga sexual activities.
Mhm.
But as much as possible, as doctors, we don't encourage also yung mga premarital sex. At saka yung kasi pag sinabi na namin na mag-protection na, parang
Mhm.